Hello and welcome to the first ever Aspire UCS live stream. And this
Hiya.
is myself, Angie, and my co-director, Jules.
Hi.
So
Drinking water. Dry
yes, drinking
January.
water and lemon squash because we're doing dry January. So, well, we're trying to. So, what we want to do tonight is to try and provoke a few thoughts here amongst the veterinary profession, because coming from the human profession, we have seen some things that we think would benefit from a little bit of help from the human medicine world. And we were wondering if anyone else has the same concerns or worries about how training is implemented within primary care. And by that, we mean ultrasound training.
What
So
we
I
want to
guess,
do is tell you, sorry, Angie, you know what I'm like. I get a thought, I have to
no,
speak.
go for it. This is very
What we
informal.
want you to do is learn from the mistakes, learn from the training that's been done in the human world, and don't make the same mistakes that we were making 30 odd years ago. It's like reinventing the wheel. Why would you? It goes round. There you go.
Absolutely. Absolutely. No, absolutely. That's exactly what we want. And that's what, that's the reason why we're in the veterinary profession now, isn't it? I mean, after decades and decades of working with human patients, we've now gone to the furry side. And obviously, we're
Some
finding it
of
a lot
my
more.
humans have been furry.
Well, yeah, let's not go
But
there.
obviously, we don't talk about that.
We're going to
Sorry.
try and keep it professional, aren't we, folks?
Absolutely.
What we'd really love, guys, is for you to make any comments in the comments box, assuming you're hearing us loud and clear, because we are elderly women of a certain age and IT
Rude.
is not our favourite topic. So I'm hoping that you can hear me. So please, somebody put a comment in the box if you can, if we
Good
are going.
idea.
Otherwise, we're chatting for the next hour to ourselves, and that could
Which
be a little.
happens a lot.
Yeah, I know, but probably not live on air. So I'm wondering if anybody can hear us. That would be great. If just put the number 4 in the box, type it in or something. Mark, I know you're online, and I think Julie is as well. And so far, we've got nobody adding a comment there. So you never know. We may not be live. It's
It
saying we
says
are.
we are.
Right. Well, let's just crack on. Come on, we'll just have a chat amongst ourselves if necessary. So, some of the context that people may not appreciate is that, having come from the human world, certainly in the UK, we have an awful lot of responsibility as sonographers. And in order to have that responsibility and to be let loose on the public, your sister, your brother, your mum, your child, or whatever, to be able to scan them and to actually hope and pray that we're doing a good job and that we're working safely, is that we have to have very stringent training, don't we, Jules? So in our day, it probably wasn't as stringent as it is nowadays, but we've been
I
party
don't
to all that
know.
late.
I think it was. I think we still had quite strict. In fact, we were probably had more strict ways of working because we didn't have autonomy when I very first started scanning
Yeah,
in
that's
the
true.
in the 1980s. We didn't have that direct autonomy that we have now. So I think we were more constrained back then.
Yes, we were definitely following protocols, weren't we, and reporting templates and things like that, and very much being supervised and closely watched by the radiologist, the
Spied
doctor.
on.
Well, yes, I know, but soon, as is happening in the veterinary world, soon, we found that the radiologists had other things to do with that sexy MRI and CT invention. So that left us all holding the baby, quite literally, didn't it? So we had to step up a notch and start taking on more responsibility, and that included reporting and diagnosing within the human world. And I think
I
we're
think
still
we're probably the only ones, aren't we? I think as far as we're aware, there isn't another country where sonographers have the same amount, the same degree of autonomy that we have. They may be very skilled, but the rules still apply that only a medical doctor can do a formal report. Whereas in the UK, sonographers, and bear in mind, sonographer isn't a protected title. So to be honest, anybody can go out and buy a machine and call themselves a sonographer and do scans, and no one can stop them because
no.
they're not breaking any laws, because it's not a protected title. They can't call themselves a radiographer. So certainly myself and Angie, that's our registered body, radiography. but anybody can be a sonographer. Woohoo!
No.
Who knew?
And this is the same. This is what's happening with the vet nurses, isn't it? In the UK, they are not. They're fighting for, protection of their title, because anybody can call themselves a vet nurse, regardless of whether they've got qualifications or not. Is my
Is
understanding.
it vet nurse or is it registered vet nurse?
Registered vet nurse.
They can't call
Registered
themselves
vet nurse.
registered,
No,
can they?
registered vet nurse. Registered vet nurse. Gosh, stand corrected. So, I mean, I remember my training, and it was very much in those days, it was centered around making sure you had a big bolus of knowledge that you swallowed, that you could churn out at a couple of written exams. Then you had an OSCE, and then you had this great big clinical logbook with 30 cases that you had to submit when you went for your OSCE, and they'd look through it and they'd decide whether or not it looked like you knew what you were doing, and you either passed or you failed. It was quite a high pass rate, wasn't it? 75%, which put a lot of people off doing ultrasound. I think a lot went into other imaging modalities like nuclear medicine and things like that in those days. But then obviously with time, and we've got colleagues and close friends who have become qualified in ultrasound, but they have a different type of degree qualification compared to our diplomas, haven't we? It was a postgraduate diploma, and now there are master's degrees available in ultrasound, aren't there? Clinical ultrasound, not just in the subject of the science of ultrasound. I mean, practicing in ultrasound. There's also direct entry we've got now, haven't we, to try and
address the issue of the fact that there just are not enough bums on seats. There just aren't enough people with
not enough skilled people doing ultrasound.
Do these things. Just as a bit of context, if you think about the numbers of ultrasound scans, this is in the human world now, and in England, it was something like 10 million ultrasound scans were performed in England, so not Wales, Scotland, Ireland, between February 2022 and January 2023, 10 million ultrasound scans. Yeah. And those are scans that are of NHS patients. So they might have been done by the NHS, but they might also have been done by private companies subcontracted by the NHS. That 10 million doesn't include people that might go to private hospitals or private clinics. 10 million!
And it's a heck of a lot of scans. Now, the beauty that we had in the human world when we're learning ultrasound, which, as we all know, especially those that have had a go at ultrasound and have maybe realised that it actually isn't quite as easy as it looks, or as some people make it look, is it's a very much an operator-dependent form of imaging, isn't it? And you need to have inherent hand-eye brain coordination to be good at this. And that's just part of it. You've still got to have all the medical understanding and the knowledge and how to interpret what you're seeing on the screen to be able to come to the right conclusions. And you also need to drive that ultrasound machine. And
that's
I think
a critical thing for me.
Absolutely.
You can, if you don't have the practice at a practical skill, you're never going to get good at it. And I think that is something that I've noticed in the vet world, because in the human world, there's a never-ending supply. Oh my days, a never-ending supply of people to scan. Everybody and his brother has had a scan. But it's not quite the same, particularly in primary care. You don't have that continuous hamster wheel, really, of patients. So I think that is part of the difficulty that I think primary care vets face, the numbers of patients.
And I think, I don't know about you, but I know that when we were, training ourselves, and then later on when we became lecturers and assessors for other sonographers in the human world, in medicine, we very much found that there was a great camaraderie and a sense of mentorship at what you were doing, wasn't there? There really was. So it was quite easy for you to have a buddy that you got on with, that you could connect with, that was there sort of as your wing woman or your wing person to make sure that you were safeguarding, that you didn't go down a rabbit hole or the wrong direction when you were interpreting that scan. And of course,
and every day was every day was a school day, wasn't it? So even though we've been scanning for 30, however many years each, there's never a day goes by when I'm scanning and thinking, oh, I've just learned something I didn't know. Every day is a learning day, and you can then share that knowledge. So if you think, how much we've amassed in the 30 odd years we've been doing ultrasound, and only ultrasound. That's a lot of knowledge to share.
It is a lot of knowledge to share. I think one of the things that I think that is an issue for vets in primary care is they're very much on their own with this, and learning a practical skill when you are on your own is really, it's nigh on impossible, I would say. Hat off to those people that do pick this up and do well at ultrasound when they have literally been learning it solo, and I'm sure that's the majority of people actually have to rely on that. I always think about driving a car. Imagine if
I've been in the car with you. I'm not sure about this.
No. So imagine if you are in that car, okay, and you are driving your car, and you are picking up somebody's daughter, somebody's loved one, somebody's pet, whatever it is, and you have never, ever, ever had a driving lesson. So you've had nobody sit next to you in the passenger seat and tell you what the pedals do, where the controls are, where the indicators are, what the purpose is, how you use gears, what are they there for, etc. Imagine if you'd never had a driving lesson. Then imagine if there was no such thing as a highway code. Now, having just come back from Sri Lanka and our tuk-tuk challenge, we're not sure if there is a highway code there, and we did survive, strangely enough. But we were quite grateful for our highway code back in the UK.
Rules. You have to have rules.
Yeah, rules and standards. So, what is good practice when you're driving? If nobody tells you what that benchmark standard is, it's very hard for you to achieve that, particularly if it is a practical skill. Would you agree?
So how could I not agree? I was in the car with you. I was in the tuk-tuk with you.
I know that we did nearly fall down a few potholes, and but there was all sorts of things. You nearly hit a few dogs, stray dogs, and there was all sorts of things that went on, but we survived, and it was a great challenge. And we raised some money for charity, which is the main thing. But going back to what we're saying, I think that learning on your own in a clinical room, because you've got to do that scan and you've got the equipment, it's been provided for you, and you know that ultrasound's probably the right test to be performing, it must be really scary to be daunting, if nothing else. It's enough to put anybody off to get that kit out, dust it down, and have a go, really. And that's just looking at the controls. Never mind.
You know what, though? I know you say, Ange, it must be terrifying being in the primary care and you're on your own and what have you. But when we trained as sonographers, we were on our own. I know there were people in the other rooms that we could maybe call on, but you were on our own. But what kept my nerves calm, what kept me calm, was knowing that I had been trained well, that I could drive this machine. So again, when we were in Sri Lanka and we went into the hospital and we were helping them with their ultrasound machine, because I know what ultrasound machines are capable of, I was able to work out what the machine was, where the buttons were, and how to help them. And that only comes if you've had a good basis of training, a sound. Did you like what I did there? A sound basis of training.
Yeah, absolutely, totally get that. I totally understand where you're coming from, and I agree with you. Well, we're cut from the same cloth here. I don't know what other people are feeling towards this, and if anyone's got any comments on what we're saying, please feel free to pop them in the comments box, and we'll try and address them as we go along. I think you're right, though. You do have to have that sound base of training, and we definitely probably had a really quite formal training on the physics of ultrasound, wasn't it? To the point where actually it was enough to put most people off.
I didn't understand it. I just learned it off by heart. I learned it off by heart, and then listening to you talking to some vets, it suddenly kept. I was like, that's why I do that. Right. How many years have I been doing it?
Don't believe everything you hear, folks.
All right, I had a bit of an understanding, but you explained it in a way that even I could understand it.
Well, it's about being relatable, isn't it? When you're teaching
Yeah,
and training
absolutely.
something, I don't know about other people, but to teach something, it has to be fun. It has to be engaging, and it has to be, not so serious that you're actually going to send everybody off to sleep. And but there are important principles here with ultrasound that if you don't have those, similar to driving your car, you could potentially be dangerous, maybe. And I don't mean to be a bit dramatic, but if you're not driving that machine,
Maybe it is dangerous.
well, yeah, I
It
know,
is dangerous. If you think, like I said, those 10 million ultrasound scans that were done in England,
yeah,
I imagine anybody listening might have had an ultrasound or know somebody that had one. You would want to know that the person doing it actually had been trained properly. I don't believe anybody pootles off for an ultrasound scan and thinks, well, it doesn't matter if they've done a half day online and a half day on a course with another 40 people, they'll be fine.
well,
It's got to be engaging, but it's actually got to be real.
it's got to
And
be
we
fit
all
for
learn
purpose.
in different ways, don't we? That's the
Oh,
thing. We
absolutely.
all learn
Yeah,
differently.
well, you and I are very much visual learners. We like
Yeah.
analogies, and we like to see things, don't we? So that for us, that's a great way of making it stick. And I think often sonographers are quite visual. Obviously, that's why they go into the job. That they're
Yeah.
either a closet detective, or they are a perfectionist, or they like to look at images and pretty pictures. And I think
Or
combining
like
all
me,
those,
they didn't get a pay rise.
well, that's another thing. That's another thing. But going back to the vets and what we've, established in our time in doing veterinary ultrasound, and we've loved every minute of it, and it has been quite a few years now. But a few things that we've established, and we're only talking from the UK's perspective because that's all our experiences, is that there is obviously the formal route to those that want to do ultrasound. There is the residency, which is, one hell of a slog. It's about 3 years, isn't it? It's, there's a lot going on there. And I think that there's, a lot of pressure on them. They've usually had to drop their salary, or they're doing lots of on-call. They're big exams, etc., etc. And
How many
and then,
residents are there then?
well, how
There
many
aren't going to be as many residents, are there, as primary care vets?
No, absolutely not. And
Because
I
there
think
aren't the number of posts, are there?
no, and also what's happening at the moment is a lot of the radiologists, as or the imaging specialists, as we call them in the veterinary world, they are are now going into teleradiology. So that's making it even harder for those interns that want to become residents to become specialist imagers, because the availability of people to teach them is not as great as it was before. So there's less places. So therefore, we're training less. So the pressure's on. So how do we get that standard to stay at that standard in referral hospitals, so that our primary care vets, if necessary, have somewhere to refer on if they are out of their depth, or they do feel that they need a more specialist opinion or more specialist imaging. So, that's obviously a big concern at the moment. Now, I know that, when we come back to primary care vets, and first opinion practice, there are routes that they can go down to become more proficient at ultrasound. And we've got a comment here from Mark from Samsung, and he's saying that, Samsung have got a big drive worldwide about trying to help educate within that veterinary space. And they're trying to, help with the AI platforms and things like this, which is going to help hopefully primary care vets. And that can't be anything but good. But one of the things they struggle with is they're also under a lot of pressure. There's a shortage of primary care vets as well, isn't there? So releasing vets to go and do training is hard in the first place, because they're needed in clinic. It's also very expensive to CPD in the veterinary world, and massively so compared to the human world, isn't it? Well, we found that.
Yeah.
But there is no standalone ultrasound certificate at the moment that's got sort of a badge associated with it that gives
So
it.
even specialist imagers don't do just ultrasound.
Well, there are imaging certificates for primary care vets, and they're, Improve International do them. They're all College of Veterinary Surgeons do them. But I think the only one I'm aware of, and I may be wrong, is IVUS, the International Veterinary Ultrasound Society, which is mainly based in America, or it started in America, but it is international, and they do a certificate. But that actually, to be awarded that certificate, I think it's over 3 years, and you have to submit, about 15 full-on case studies. It doesn't have any competency assessment with it. It's obviously you're deemed competent from how well you write your case studies and how you produce your hard copy images, whether they meet the pro forma and the criteria, which is probably the best we've got at the moment to being anything like how we trained, where we had those where we had our sort of competency assessments in human ultrasound. So I don't know. I do think that what is assessed with competency in the veterinary world at the moment is surgery assessed with competency, because
I don't know
we've
that
had
it is
these
it?
conversations with other vets before, and some of the vets that are on our sonographer on your shoulder program have said that very little of their training was competency assessed. So maybe we are, unicorns in a world where we're saying that this is what should happen because this gives a guarantee that somebody can do the job, but maybe in the veterinary profession they measure it a different way. But when you've got a practical skill like ultrasound that is operator dependent, much more so than cross-sectional imaging and plain film, I think that there is a need to have some sort of competency element in it.
So do you think then this needs to be when they're doing their vet training?
Yeah, absolutely.
Because it's a day one competency in the UK, isn't it? I think they've got, is it something like 45 day one competencies? Yeah. And being able to perform an ultrasound scan is just one of those. I mean, I don't know how they don't walk out of grad school and their heads explode when they get to fresh air.
They do, to be honest, because learning to spay animals and do all that is all day one competency. So how on earth can you expect somebody who's been training on a variety of different species over the same length of time as the doctor has, for one species, to expect them to be able to go out and be able to turn the hand to absolutely everything? I mean, it's a lot, and a lot of expectation. So, but I do think there is a need for more robust training, undergraduate, without a doubt, and certainly at least introduce some if they haven't got any already. And there are some vet schools that are trying to address that now, aren't there? I think, from what I gather, the other way of training that we understand ultrasound within the primary care is to go on, a 2-day course. And, obviously we run 2-day courses at Aspire, don't we? So, we run them, but you've got to go do some online courses and training. We do online courses as well. But we are realistic in that we say you're not going to become competent after doing that 2-day course. You're not going to be competent.
No, we make that quite clear. Yeah. But also, I think very much you can do a 2-day course where there's 50 people and one person teaching, or you can do a 2-day course where there's 10 people and there's three people teaching. You're going to get more hands-on, aren't you? And I think always we are going to go back to what happens in the human world, and the way it's done there. And there's no way we would be allowed free on people, on patients, if we hadn't proven our ability. And to be honest, I wouldn't have wanted to do it. I needed, and if I'm honest, on the day I qualified and they said, right, you can go and run a list now, my first thought was, I wish I'd failed, because I was a bit panicky. And that's knowing I'd got a good sound training program behind me. But I also knew that there were people that I could, I mean, it wasn't mobile phones in those days, but, I could ring a colleague, phone a friend, and get some advice and help that way. And that support, that is what it's about. Like-minded people. And I still don't worry about having to ask for help.
So how can we make it easier for vets to gain confidence in this field? So how are we going to I mean, we can't fix this, just the two of us, but at Aspire, we're trying to experiment, and we have developed some ways of teaching, blended learning methods that are proving to be quite successful. And that's not us blowing our own trumpet here. It's actually, we've taken these elements from how we train in the human world, and we're employing them with the vet world and trying to support vets in the way that human sonographers work.
Having the blended learning, because as we've said, people learn in different ways. Absolutely. So it might, one aspect of it might trigger with one person, but another person might find it better. So the online thing, that might be great. Other people might need to read the notes, read our guidelines, the guidelines that we've written with the British Medical Ultrasound Society and the European College of Veterinary Diagnostic Imagers, that having things like that. Well, that's your highway code, isn't it? It is
essentially our highway code. So those are your rules of what you should be doing when you scan. So those of you that haven't already had a look at that document, it's there. It's free. It's an open document. You can go online at bemis.org and just click on that and download a copy. And the first part of that document is all about the professional issues, which are just as important as the scanny bits, aren't they? Otherwise we wouldn't have bothered with them. And the aim with these documents are to always update them and also to build on them. So it may well be that we can get hold of some of anaesthetists, and we'll have a section in there on local regional anaesthesia under ultrasound guidance. We might have basic cardiac section. So the aim of those documents is to start building on them eventually. So we definitely have that as our highway code. So anyone that's out there and learning ultrasound in primary care and wants to try and have a standard or knows what a quality scan should look like.
You've got to have a benchmark, or else how do you know if you're achieving?
But if you're on your own and you're scanning and learning.
Julie's put in one of the questions: how can we make it easier to gain confidence in this field? And I think a part of that is, if you know what you're actually working towards, that's a good step, isn't it? Knowing what you're supposed to be able to do, you then know what you're working towards. And Mark has commented, weekend workshops with guest professionals would be well attended, and basically getting an accredited course, which is something we've been banging the drum for.
So we're running weekend courses, as you know, and they are successful, and people do go away feeling a lot more confident. And it's very important not to get confidence and competence mixed up, isn't it?
Oh no.
So they go away feeling a lot more confident than they did before they arrived on the course, which is obvious. Now, in the human world, whenever we do a course, certainly a university or higher educational institute course, then a lot of the courses that are seen to be top notch and the good ones to go on are accredited by CASE, aren't they? The Consortium of Accreditation of Sonographic Education. So it's like a badge, really stamping that course as being, this is it. This is one of the it courses. And if, there's nothing to stop a veterinary course being accredited by CASE either. So, also by the Royal College of Veterinary Surgeons, or, there must be ways that we can get, I know they have race accreditation for some CPD courses in the veterinary world, or CPD events. So, I think we have to start looking at how we can, have a benchmark standard for training that is expected, that GPs need to attain to before they maybe leave, or their training.
Who trains the trainers, though, Ange?
I don't know.
You can. I've been on courses where I've listened to people talking, and I've thought, I actually know more than you. You probably shouldn't be teaching this, because what if they've not been taught properly?
Yes, this is always the big worry with in-house training, isn't it? It's this grandfather course. And this happened, actually, it nearly started to happen in the human world when we first got very small, portable, affordable equipment.
Oh, yeah, every department owned an ultrasound machine and nobody knew how to use it.
No, but if somebody had used it before, or they were the most senior in the department, they were assumed to be the most skilled at it. But that actually doesn't mean that they were teaching the right.
Terrifying.
I know, well, it was. But then, thankfully, the human world stepped in with some governance, okay? And that's another thing that, maybe needs to be sort of taken a look at? For example, the Royal College of Veterinary Surgeons, what about their practice standards? There's not really anything on ultrasound for specialist referral hospitals, let alone primary care.
No, I think it says something like you have to have an ultrasound machine capable of producing images, but it makes no comment on whether anybody needs to be able to actually use it properly. That in itself terrifies me, because I love my dogs.
But that's not really a standard then, is it?
No.
No, so it's not a clinical standard, is it? It's an equipment standard rather than a clinical thing. So I think we've got to sort of have a little bit of governance brought into this, as well as having some sort of accreditation. I think it would be great if higher education institutes could take on some responsibility for the training. I know that, a lot of vet schools are very busy, they've got lots going on, but, that it does make sense that they're the teams that should be doing them. That
as long as the teams delivering it know what they're doing.
Yeah, absolutely. But the other way is that, the great big organizations are getting involved in the training. And, that's a great way to make money for some of them. And again, it's not always going to mean that the person attending that course actually meets their learning objectives, is it?
If they even have any learning objectives.
Well, I think some of them do. And we have seen some good ones, don't get me wrong. But, I think we have to be careful what's out there as well, as you've said already, that not everything is endorsed appropriately, shall we say. But, because somebody, is being sponsored by some company, doesn't always necessarily mean that information is therefore correct or the best information that is being imparted. And I think one of the things that is also we've found very successful is having mentorship. And I think that's what sets us apart from other people, is we have developed this ability to be able to have a community style mentorship group.
It's like a support group, isn't it, almost?
Oh, it's great, isn't it? It's like having a family, really, an ultrasound nerd family. And the people that we have on this are actually accelerating their confidence and their learning, I find.
And they're sharing with each other, and that's what I love.
And the
every day is a school day.
Absolutely, as we found out today when one of them didn't get it quite right, and that's
and the great thing, what I loved, she turned to the group, to the community, knowing she'd not got something right, but coming away feeling, do you know what, I didn't get it right today, but I'll never make that mistake again. And we all do it, it's about support, isn't it? And I think she went away, she came into the group this morning feeling a bit down and despondent, and then left thinking, do you know what, at least I tried, and most of the time I do get it right, and that was great.
Well, I think the day that you think is a dangerous day, isn't it? The day you think that you know everything, because that's not, you never stop learning with ultrasound, as I'm sure most people out there know.
If you think you know everything, you should hang your probe up.
It's all very easy to say this doesn't work and that doesn't work, and this is how it's being done at the moment, blah de blah de blah. But I think what we've got to try and do is look at things from a positive way and say, well, what do we know that does work, and what have we got going?
Mark's made a good comment. He's put, we have to find the balance between clinical and equipment standards, and he's right, because we've been into vet surgeries where the ultrasound machine, you could weep, because there's no way they're going to be able to use them because they're so old or so clagged up in dust and cobwebs. So you don't have to have expensive equipment for it to be good, but you've got to be able to drive it and know it.
Well, and I think we've had often, haven't we, on our courses where we've seen, people say, oh, we've got a really rubbish one back in clinic, it's awful, it's this, it's that. And by the end of the course, they've gone, well, actually, maybe it wasn't that our equipment's a bit rubbish, it's just that we didn't know how to use it.
Well, then they come back to us, don't they, and say, gone back to work, looked at the machine, done what you told me, correction, it's not the machine, it was us.
Yeah, and you know, that's what's lovely about training people and seeing that end result, isn't it? And that satisfaction that they get, and that joie de vivre for going back and getting stuck in again and having that passion that we've got for
and
ultrasound.
sending us pictures.
Yeah, absolutely lovely little
And I have
thumbs
to
up
say
pictures
as
like that.
well, don't forget, we've had people have brought their machines and like plonked it down on the table. This is the rubbish that they're expecting me to work with. And then by the end of the couple of days, we've actually managed to get some decent images, and we've gone through and made a difference. And I think so. Julie's asking here.
No, she's saying
she's put a bad workman woman always blames his tools, but she's also asked, as training providers, what makes you different and meant from a place of interest rather than to be challenging, by the way. Oh, I can feel a fisticuffs coming on me.
I told you.
I didn't read it as challenging, Julie, not at all.
No, I think what does set us apart at the moment, and I'm sure it won't be long before other people take on this kind of trial and approach, but it's working, and we've got a great rapport with our what should we call our members, because I don't call them students. They're not students, they're not trainees, because they're all qualified.
First thing that sets us apart, Angie, is between us 65 years of only doing ultrasound.
Well, teaching it,
yeah. So performing ultrasound and actually teaching ultrasound, and not just in the human world, in the vet world. You know, we've got experience in the vet world. So we're not vets, don't want to be a vet, not trying to be vets, not trying to be vet nurses. We are ultrasound specialists. We are experts in ultrasound, because that's all we do. We don't do CT, we don't do MRI, plain film. So that absolutely sets us apart, because we know it better than, I'm going to just say this now, better than anybody else in the industry.
Well, I definitely think we have a passion as well for it, and that makes us good teachers, because
it's the best imaging modality there is. You can do so much with it.
I know, it's so flexible, versatile. It's just the most amazing clinical tool.
Cage side, you can't take a CT scanner to the cage side, can you?
No,
and climb in the cage, which you've made me do before now.
No, absolutely, and you can't take it out into the field either for your cow, can you? Or your goat or whatever. You can't, you know. So, you know, it is such a versatile tool, and it's really important that vets come out of vet school, I think, being able to have a good go at knowing how to optimize their images, if at least they have an understanding of how to drive that system and what normal structures might look like. Then I think that they're halfway there, aren't they? They really are halfway there, because we don't expect everybody. No one can possibly be an expert at everything. We're not experts at it.
I am, absolutely.
Well,
I'm not, to be fair.
No, the important thing is to learn when things don't look right.
Yeah.
You know, yes, it's normal, you know, or no, that doesn't quite look right. Then you've got your referral practice. That's where you want to be sending it. So, you know, for those vets,
a lot of the time, a primary care vet, they can do a scan and they will be able to work it out, because even now, you know, we've got books. So if you're looking at something and you think, I know it's not right, but I'm not sure, there's some fabulous vet ultrasound books out there that you can look and you think, oh my days, that's exactly what this looks like.
But you know, but that book's no good if you haven't got the technique in the first
place. The ability to drive the machine, absolutely.
And to get images and to actually access those structures.
No, I just meant for if you're seeing something and you're not sure what it is.
Definitely. Oh, there's lots of ways of looking up pathology. Definitely. And there are some good online resources. Obviously, you know, we've got some, haven't we?
We've done them.
but there are some really good online resources, and that, you know, it's just
some not so good as well.
Well, this is it. You've got to be careful about, you know, who you trust and what you are actually looking for. Now, we've been talking very much primarily about how we've seen things as you know, a couple of sort of, I keep saying this, but a couple of unicorns that have entered into the veterinary world. I know, but it's taken us a while to develop and build up trust within our vet peers, hasn't it? So, you know, I understand that. It's like having a vet come into the human world. You know, that's going to be, you know, quite difficult. But we're there. We've got some amazing advocates behind us. We've got some fantastic organizations that have been working with us as well, that have, told us, keep going, don't stop what you're doing. It's brilliant. It's really working. It's making a big difference out there. And this is why, we're wanting to do more of these live events, isn't it? So I think that it's important that we also look at what's going on outside the UK. Because today we've had one comment from a gentleman, a doctor in Lahore, who's said, we need more help in the developing world. We're vets out there. We don't have access to all the finances to be able to have the fancy kind of training that a lot of places, are getting in the Western world. So, we've got to try and look at how we do this globally as well, not just locally, and whether it's in
the tough one though, isn't it, Angie? Because if vets are struggling in the UK where there is funding and money available, and Julie's commented again, a lot of vets are nervous giving it a go through fear of getting it wrong. Absolutely. What would you say that a vet practice should do about their dusty old underused machine?
First of all, they need to get in touch, because, we offer free 30-minute informal chats. They can just put one in the diary from our website. That's not a problem. And you'll see the link to our website on the LinkedIn page that you booked for this event. So that's dead easy. Get in touch with us. We will just set up a virtual meeting like this, have a chat with you. And, we've
had a machine in front of you.
Yeah, we've
done that for people, haven't we?
Yeah, we're free, advice. That's what we're here to do. But moving on from that, once you've got that dusty old machine out, we want to help you build this machine into a valuable clinical tool, but also a valuable business asset. That's really important too. We forget to mention this, Jules, don't we? Because there's a big range of what people are prepared to charge, or what they feel comfortable and ethically capable of charging for something when maybe they're not quite confident or sure about what to do. So
especially now, there's a current ongoing thing. The Competition and Markets Authority are investigating the vet industry, as I'm sure everybody knows, and they're looking at whether pet owners are actually getting the information that they need at the right time to get appropriate information for their pets and the right treatments. Wow. So people are going to be starting to say, well, who's doing this ultrasound? Am I getting value for money? And if you've been trained properly and you're feeling more confident, you can charge what you're worth. At the moment, I think so many vets, like Julie says, you're nervous about doing it. So you don't charge what you actually should be charging, because it doesn't feel like you're giving the best service. And that's not good from a mental well-being perspective, but it's also not good from a business perspective. No. It is a business at the end of the day.
Well, this is what we have to remember, and there are a lot of vets I know that are under pressure, from management to actually be using these ultrasound machines more and more. And if they're not feeling confident about that, that's not a nice place to be in, when you feel you should be doing it and you're not just confident enough to crack on and do it and to do a good job of it. Everybody wants to go home and sleep at night and do the best job possible, don't they? And as you say, it is a business asset, that ultrasound machine. It costs quite a lot of money. They're not that cheap. They're cheap imaging compared to CT.
got theirs free.
Well,
which is why when I looked at it, I could have wept.
Well,
there's no such thing as a free lunch.
No, but it's important that you have an ultrasound machine that's fit for purpose, and that's a very easy to trot that off the tongue, fit for purpose. But you need one that's going to be tailored to meet your needs. There's no point having a cattle ultrasound machine if you're dealing with small animals. You're going to have the right equipment. If you're a cardiologist wanting to do sophisticated cardiology ultrasounds, then you're not going to get very far with your handheld point of care ultrasound machine. So you do need to make sure you have the right equipment for what's expected. So if your management are saying you need to do X, Y, and Z, but the equipment isn't the right equipment for that, then there's the potential for a business case there, isn't there?
Yeah, and we have helped people with business cases where machines really haven't been safe. let alone fit for purpose. Not because if there are some that are so old that they really aren't going to do the job that you need them to do, and that does not inspire confidence. If you're a little bit apprehensive anyway, if your machine really isn't good enough, then that's just going to compound your concerns, isn't it? It would certainly would mine.
And I definitely think that if you have got an ultrasound, a piece of ultrasound equipment, and you're not confident, the first piece of advice I would say is get the manufacturers or the distributors back in touch with them and get their clinical apps specialist out to work with you, because it may well be that it's not been regularly looked after, or it may be that it's not been set up quite appropriately, and they will be able to give you a little bit of training on that equipment that's going to give you that head start. They're not going to be able to train you to do ultrasound, and let's make that clear, because that's not what...
They might be able to give you presets, though. Presets are a good baseline starting point, aren't they? As long as they're not the factory ones, which bear little resemblance to actual scanning.
And don't forget, we've also helped people that have had ultrasound machines and they've been able to swap out equipment, once we've got involved and helped, talk to both parties, and they've been able to swap out pieces of equipment. So they've ended up with the better kit, but with no financial loss. So there's lots of ways that your distributor will want to work with you, because they want you to be happy with that piece of equipment. They want you to be endorsing it. And let's face it, we all want the best for our patients. And more importantly, we want the best for our clients, don't we? Because, in the human world, our client is the patient, isn't it? Essentially. Whereas in the veterinary world, our patients are brought to us by the clients. So there's a slight, distinguishment there that needs to be made. And that's why there's a big difference.
I think as well, sorry, Ange, I think there is a growing, I won't say trend, but move towards vets being sued. I pray to God it never gets the way it is in the human world. I don't know if people are aware, but I think it was last year, £6.6 billion of the NHS budget was set aside for clinical negligence claims. Now, obviously, that's never going to be the case in the vet world, but I think people are becoming clients, patients, call them that, are becoming more aggressive in their dealings with healthcare professionals, vets, and it is moving that way. So at least if you feel, right, well, I know that my training was solid, my training was good, and here's the images to prove it. Yeah, I might have missed something, but look, here's the images. This is how I normally scan. I was unlucky that day. Then you've got a defence.
Yeah, absolutely.
That is really comforting. Certainly, from my perspective as a human sonographer, knowing that I can gladly let somebody look at my ultrasound machine and see all the scans I've done on that machine, and know that my standards, I'm following the protocols, I'm following the benchmark standards, and I was just unlucky. And I think that is important, because vets are on their own. So at least if they know that they've got that solid basis, then they're less likely to be frightened about doing it, I think.
And this is where we're trying to go, isn't it? Eventually, this is where we would love to be able to go to help vets and vet companies to know what a good ultrasound service looks like, not simply what kit you need, how to drive it, how to do the technical scanny bit, but also
it's like the holistic approach, isn't it? It's the holistic approach for a service.
Absolutely. And looking at, governance, how are we going to look after this piece of equipment? How are we going to look after that staff member and make sure that they stay current and they stay up to date and they stay confident and feeling good about what they're doing? How are we going to help them to diversify if they need to? How are we going to get more out of this piece of equipment? So that we can bring more ultrasound generated revenue back into our business? And how are we going to keep and sustain those standards so that we know we're always offering a good service and that we've always got a good reputation and that we can command the fees that we feel
the right fees,
yeah, we deservedly should be charging. And there's nothing worse, is there, than having a scan paid for that's coming out essentially for most pet owners out of an insurance pot, isn't it? You have that scan
most
paid.
pets insured in the UK, is that?
Well, a lot of, I wouldn't say all are, but obviously, but I think most people these days, most responsible pet owners will have insurance, I would like to
I think they're
say.
more likely to have insurance for their pets than they are for themselves, aren't they? I think
Absolutely.
there was a research document done, and there's more pet insurance than there is medical insurance.
But if you
It
think about
shows
it,
how much we love our pets, doesn't it?
I mean, there's quite a range of what, for example, let's talk about an abdominal ultrasound scan, a full survey. What constitutes a full survey and how much does that cost? So, you may have one vet next door to another vet practice, and the range in what's being charged is completely different, because one feels confident to do a big full survey, the other one's just doing target scanning, but they're calling it the same thing, and that money, obviously, for that first scan is taken out of that insurance pot, along with that excess, etc. And then supposing that scan isn't quite up to the mark, or it hasn't, found the solution, and that patient ends up going downhill and has to be referred in. Often they need another scan at the referral centre, and I've come across this when working in specialist referral centre, and you find that the clients are saying, well, we've already had a scan, we've already paid X amount, why are we having to pay probably more for a specialist to now do this scan again? And it's quite hard to justify that to the clients. And
it certainly is, without bad mouthing the primary care vet who's just done their best. That is difficult. And to go back to you saying, you can have one vet down the street charging one thing and another vet charging another thing for exactly the same thing. That's why we need standardization. That's why these benchmark standards are right. I think
I totally agree with this comment here from Lynn, is that we were the same. When you take Fluffy to the vet, you absolutely, as a layperson, assume that person knows what to do and that they can do everything. It's like us going to the GP and expecting the GP, though, to do absolutely blooming everything in the world of medicine. It is an unrealistic expectation, but unfortunately, it is the one the general public have. And you do,
because that's our only option, isn't it?
Yeah, well, absolutely, and it's
we
all
can't
we know.
Self-refer our pets directly to specialist imagers, can we?
No, you can't. So you do need to go through them, and we just need to do everything we can to support primary care vets at becoming more proficient at ultrasound, because it is such a game changer to be able to turn your hand to use ultrasound, whether you're above the diaphragm, below the diaphragm, using it for nerve blocks, whatever you're using your ultrasound for, whether it is a breeder that's using ultrasound, you have to know what you're doing. You have to be confident and competent to do it, because that's how we get the best patient care outcomes. And that's all any of us ever want for our pets when we take them to the vets, isn't it? And I believe that's all that the vets ever want to do deep down, is the best they can. And without decent training or standardized training of a certain level or benchmark or whatever, how can this happen? How can we get everyone to be all on the same playing field? And it's just something that I don't know how we fix it. I know how we can help towards helping with it, but I don't know how we're going to fix it completely. We've talked about having an academy and introducing our ultrasound solution, which we've got an amazing sort of modules all based around knowing what a good ultrasound service looks like. It's just trying to persuade those that are very busy people, maxed out. They're getting a lot of vet bashing at the moment, and it's totally inappropriate with what they're doing. There's a shortage of vets. There's a very high incidence of mental health issues in the veterinary profession, which we didn't realize. And it's because of the decisions they're having to make on a day-to-day basis, and it really can't be easy. And anything we do to help has got to be a good thing.
I think it's a chicken and egg thing, though, isn't it? So which came first? Because vets have got to find the time and the resources to do the training properly, or they're never going to be able to take it back to the practice. So it's got to start in the undergraduate. It's got to start there. But in the meantime, we've got thousands of vets that are struggling, that need help. But you've got to make the time. That, you know, you can take the horse to water, but you can't make it drink. So you've got to you've got to make a decision. Right, this is a conscious decision. I will take time out of my day to go on these courses and learn. And I think that's got to happen.
I think you're right, and I think my message, I think if there's one message, it is to any primary care vets out there that are, you know, worrying that their ultrasound might not be where they'd like it to be. You know, be brave and trust in the long-term return of investment that you're going to gain by investing in quality ultrasound training. Be really brave and go for it, because it's going to bring rewards to all the stakeholders involved in ultrasound. You know, that's your business, that's you as the practitioner, your reputation, your well-being, all those things that Julie mentioned.
Patients,
your clients. Your clients, they're going to come back to you. You know, if you've got good skills there, you're going to be able to turn your hand to many necessary and essential, you know, diagnostic tests that you can come up trumps with, whereas previously without those skills you may have struggled with. It is such an amazing versatile modality, ultrasound, and we know that we're talking to the converted here. And I know that we've got a few people that have been online tonight listening to us with our little old Witter on here in our little first ever live event. But, you know, there are sonographers that actually get where we're coming from, and they too are animal lovers as well. So, you know, we've got to do what we can. And please, if anyone wants our help, obviously we're there. We're there 24/7 almost, practically, aren't we?
Speak for yourself.
Well, I seem to be. So just get in touch. You know, if you want to book a free conference call with us, you can do from our website. It's readily available there, or just email at Angie@aspireucs.com or Julie@aspireucs.com, and she'll forward it on to me.
Yeah, if you want an answer, email Angie.
Yeah.
It takes me days to figure it out.
No, it doesn't. She's not really that bad. But I think this has been great fun. We might have not all solved the problems of the world, but we might have helped bring up a few interesting little concepts here that we've brought from the human world. We might have raised a few eyebrows. We might have, rattled a few cages here, no pun intended. But
I haven't sworn. I haven't said
I'm proud of you. I'm proud of you. And I didn't have to do the disclaimer either. But what's really good is that we've talked to you and we've related to you and been able to get out there. So please, get in touch if you need any help whatsoever with ultrasound. We've got lots of resources, and we have got some lovely mentorship that's working wonders at the moment that we're going to continue with moving forwards. And I think that really seems to be making a massive difference.
And we are the experts, Ange.
Well, yeah, okay, love. Yeah.
But we are in the industry, aren't we? There are no other sonographers mouthing off quite like we are in the animal world.
So you've been really well behaved up until now. Don't spoil it in the last 4 minutes.
So well.
So if you would like to see us have another of our little witterings going on, it's a bit like Dawn French and Saunders, isn't it? This, Jennifer Saunders.
Oh, so I'm Dawn French then, am I?
No, I didn't say that. But if you would like to see us again, having a live event, give us some topics to talk about, hot topics. We're all for this.
Wine.
Yeah, no, well, after January, we won't be.
After January, yeah.
After January.
But the most important thing you need to take home from tonight is the BMUS guidelines, the British Medical Ultrasound Society veterinary ultrasound guidelines are free to download, and they will definitely help you because they're the only ones that we've got. So have a look, have a read, free. That's the most important thing. Sharing the love.
Yep, we're sharing the love. And remember, be brave, trust yourself, take some damn decent ultrasound training on board, and you will never look back. You really won't. It is a game changer, ultrasound. And that's why after 30 odd years, both of us in the business, we're still banging the same drum. Spread the love. So listen, that's about all from us tonight. We hope you've enjoyed it, and let's hope we see you again soon. And don't be afraid to get in touch. So have a good evening and Happy New Year. Take care from us.
Happy New Year, everyone. Cheers to dry January.
No, we say it's good night from me, and it's good night from him.
And it's good night from her. I'm a her, not a him.
Yeah. Okay, take care, folks. Bye.
See you, everyone. Bye.